Hi, future nurses. My name's Katie.
I'm Josh.
Today we're going to be talking about electronic health records. They're something that we use every single day in this facility, and you should really be aware of and know how to work around them well. A few things that you should be aware of with the electronic health records that we're going to talk to you about is software, hardware data analysis, and also different security considerations regarding the patients.
First, I'm going to talk about hardware. The hardware are the physical workstations that you'll be using to help you connect to the EHR, such as desktops, laptops, and tablet PCs. So there's any device you use to access to input your information.
Regarding software, this is just like a generic term that's used for like collections of computer data. So there's two different categories of software. There's system software, which is just like controlling and managing individual hardware components of a computer. And then there's also application software, which is used to accomplish specific tasks other than just running the computer system. So it can be like different programs, like an image viewer, a small collections of programs that work together, like a spreadsheet or text processing, and then also a larger collection, which would be like Microsoft Office.
Alrighty, and now to data elements. As new nurses and other healthcare providers, we chart our data. So it's simple as vital signs, assessments, and any information that is necessary to have for many different reasons. Data elements are important in the healthcare records because it can be used to look back on and to compare information if needed. For example, as nurses, we use this data as a resource to figure out why our patient is having an increase or a decrease in blood pressure, temperature, and if it is normal due to their current activity or a recent medication or infusion that we are using, such as blood products, and how this could have an impact on it. So that's pretty much why we chart our data and how it is important to our healthcare.
Okay, so I'm going to be talking about security considerations of electronic health records. So throughout any hospital facility, not even with electronic health records, but throughout the facility, there's security. So you'll have badges that will allow access to a certain part of the facility. This is to ensure the quality care of our patients and also the confidentiality and privacy of them as well. So it's kind of how that relates. It can relate to the health electronic record. So security would be the protection of information. So all of our laptops, PCs, and the hardware that Josh mentioned has security elements. We have firewalls and virus protection on the computer so that you won't be able to access some websites, but that's just for the safety of all of the information on the computers. And then with the electronic health records, there's security. So some of the badges you'll have to swipe in, and they will allow access to the charting software. There is three main elements that we need to keep in mind when thinking about the software. So confidentiality is we don't want to disclose any information to unauthorized people. So some of the nurses you don't want to be accessing information on a different floor if you're on an OB floor. That's just to minimize any,
HIPAA violations.
Thank you, HIPAA violations. Integrity, so we don't want to alter or destroy any of the information on the health electronic record. So unauthorized access to an electronic health record without appropriate right or permission is similar to non-consensual interference with the body of the subject of the electronic health record. So in other words, it's like the same as assault or battery. So you don't want to change any charting. If you chart it, you mean it, you saw it, you did it, that kind of thing. With integrity, no, that goes with integrity. And availability, having electronic health records allows for all sorts of interprofessional teams to be able to access information for the patient. If we all have that availability to access, we can all work together to provide quality care for our patients. So the importance of electronic health records in general is it improves the availability, the integrity, and the confidentiality of our patients. We are able to access information quickly, and we can consult with different doctors, nutrition, social work, and everything. Everyone's able to see our notes, and we are able to see their notes. So we can see lab values quicker, we can see prescriptions quicker. So does anyone want to add anything else?
Just to sum it up, with the EHR, it's just, again, a documentation tool. that yields data that help enhance patient safety, as Haley talked about, evaluating care quality, maximizing efficiency, and measuring staffing needs. It can be thought of as just like the digital version of the patient's chart. And as Haley just also said, it can be made available to any authorized user. So that would be like pharmacy, what she talked about, doctors. So it's just a way for everyone in the healthcare facility to collaborate on one patient efficiently and safely.
Thank you.
Thanks, guys. Good luck.